Good morning.
Good morning. You have your sheet?
I do.
Fantastic. Okay, so we're putting in a catheter today.
Okay.
Gather your supplies, and I'll meet you at the bedside.
Okay.
We're going to be in this bed right here.
All right, thank you. Knock, knock.
Come in.
Good morning.
Good morning.
How are you?
Oh, I'm okay.
Well, my name's Angie. I'm going to be your student nurse today.
Okay, Angie.
Can I verify your name and date of birth, please?
John Smith, 7/28/50.
Okay. Do you have any allergies?
No, I don't.
Are you in any pain today?
My stomach hurts a little bit, my lower stomach.
Okay, well, the doctor has written an order to put a catheter in because you're retaining urine.
Oh, that'll make it feel a lot better, I bet.
Do you know what a catheter is?
Yes, I had one when I had my knee surgery about 3 years ago, but now, do they all come in the same size?
No, they come in various sizes. What we're going to do is put in an indwelling Foley catheter, and I think it's a 16 French, and that's the average size. But it will go into your bladder, via your urethra into your bladder, and drain the urine, because I think that's why you're having some discomfort down there.
Okay, yeah, that sounds about right.
Okay. You're not allergic to, or are you allergic to betadine or shellfish or iodine?
Nope, no, I'm
Okay.
good.
Very good, very good. All right, so what I'm going to do is just quickly take a peek at your peri area and do some peri care.
Okay,
So I'm going to put on some gloves. And the reason why we do this is because we don't want to introduce bacteria into your bladder, which could cause a urinary tract infection. So I've got my doors closed, I've got the curtain pulled, so we're going to provide for privacy.
okay.
Okay, so I'm just going to keep you covered as best as possible and get your legs positioned there. Raise the bed up just a little bit. Alright, and these are just some wipes. We can use washcloths, we can use wipes, we have to use something to clean the peri area.
Okay.
Okay, and I'm just going to use a different corner for each area of the labia here. So, front to back.
Now, is there a reason you clean one side as opposed to the
front to
other?
back. We want to make sure we get all of the areas, so we go from the side farthest from you to the side closest to you, and then down the middle.
Okay.
We want to make sure we're getting all the bacteria that we can away from the urethra, because we don't want to introduce bacteria into that when we insert the Foley.
Okay.
All right. Are you comfortable?
Well, I guess as comfortable as I can be.
Yeah, I know. I'm sorry. It's going to be uncomfortable maybe for just a minute or two, but we'll get it so that you're better. Okay, so what I'm looking at now is to make sure that my package is not compromised in any way, to make sure that my Foley catheter is within the expiration date, and it is.
Okay.
And this is a sterile procedure, so we've got to make sure that we maintain sterility to prevent those catheter-acquired UTIs.
Okay.
This is my lube because we can't use the regular lube on the mannequin, so we use soap. I'm opening away from me first.
And what is your border on that?
1 inch.
Okay.
I have a 1 inch border that is no longer sterile.
Okay.
I'm going to put this drape underneath you. Can you lift up your bottom for me? Thank you. And you see this drape just folded up, but that's okay. It's not terrible. Just know that I've touched up here, that this area down here past this square right here is no longer sterile.
Okay.
And then the 1 inch border, and of course what's underneath her buttocks is not sterile.
Okay.
Okay, so I'm going to grab my gloves here. And I can move this. I just have to reach underneath, because underneath is no longer sterile.
Okay.
And I don't want to go over my field here. And I still have the 1 inch border.
Okay.
Picking up on the inside of the glove. this I would drop in the trash can over there. Now I have this glove. I'm holding it on the outside because I'm holding it with my sterile glove, only touching the inside with my hand.
Okay.
My gloves are on.
Very good.
I'm not going to use this drape. This is used for men.
Okay.
I have a lady here. Okay. All right, so what I would do next is I'm going to set up my field. I'm going to empty my iodine into my cotton balls there, which we're going to just demonstrate, not really do. I've got my lube here, which we can't use on our mannequins, so I'll use the soap here, but if it were a real person, I would squirt it into there and use it on my patient. Okay. Then I can separate these out, and remember, inside this box is sterile. So anything inside of here is okay, it's fine. I'm going to take this blue sheath off. Careful not to contaminate and let it flop around because it can be like spaghetti. But my goal is to keep that catheter from flopping around and getting contaminated. Okay? Then I would just drop this. You never want to place anything on a surface. You just drop it because otherwise you run the risk of contaminating it. Okay, so I'm going to put my syringe onto that. Inflate my balloon. Your textbook says to inflate the balloon to test it. Okay, it's working fine. Take the water out. Okay, then I would ask my instructor, Miss Lindsay, will you introduce my lube into my field, please?
Yes, I will.
Thank you. So there's my lube, and this is, for competency's sake, sterile. So we lube it up a couple of inches there for the female. That's ready to go. So what I want to do now is I want to clean my patient.
Okay.
Now, once I touch the labia here, this hand is no longer sterile.
Okay.
So now I've got to work with my right hand at all times. So, careful not to go over my sterile field there. I want to wipe front to back there and drop it into the trash. Front to back there and drop. And then down the middle, front to back and drop.
Okay.
I'm not going to use that anymore. Now I can bring my box down here. Remember, the box is sterile. Everything in it is sterile. I have kept the labia apart the entire time. I've not let them close up.
Why is it important to not allow the labial folds to close?
Because those are not sterile, and if they close up, they run the risk of introducing bacteria into the urethra.
Okay.
So we keep those apart after we've cleaned. Okay, we're going to feel a little bit of pressure here.
Okay.
Take a deep breath in. I'm going to insert. And I should be seeing urine at about 2 to 4 inches. And once I do, I introduce it 1 to 2 more in the lady. And then I'm going to inflate the bulb. And then you want to take this off because it will continue to empty.
Okay.
Then, just tug it gently to where the bulb meets the opening of the urethra. I would secure it right here on her leg.
Okay.
And then I'm going to drape the Foley bag over her leg and then attach it to the bed frame, not the bed rail, the bed frame.
Why do we want to go over the leg as opposed to under?
Because we do not want it to become constricted or clogged, meaning by pressure, so that it will continue to drain. Because sometimes the position of the leg over the top of the tubing can kink it and prevent it from draining.
Okay.
Now it's no longer sterile because the urethra, or the Foley is in the urethra. So we lay the legs down there, reposition. How do you feel?
I feel much better. I can definitely feel that pressure in my abdomen relieving.
Oh, good, because you've got some drainage here. It looks like you have about 400 or 500 milliliters of urine out. And it's clear, so that's good. So that's what we would document. We were going to document that Foley introduced into the urethra, 400 milliliters obtained via Foley catheter, clear urine, no sediment, tolerated procedure well.
Okay.
Okay? All right. So now, for the sake of the competency, you're going to take the Foley out. So we just pretend like it's a different day. You're going to, of course, do hand hygiene, introduce yourself to your patient. Good morning, I'm Angie. I was here the other day and took care of you.
Oh, yes. Hi, Angie. How are you?
I'm fine. How are you feeling?
Oh, I'm good. They say I get to go home this afternoon.
You do. So we have an order to take your catheter out.
Okay.
Okay? This doesn't hurt. The only thing you may feel is maybe a little bit of pressure.
Okay.
But all I need is a syringe
Okay.
and a towel.
Okay.
And I place my towel down here. I want to verify your name and date of birth, please.
Janet Jones, 7/28/50.
Okay, any allergies?
No, ma'am.
Okay, got my patient. And then what we do is we just remove the water. And when we documented our Foley insertion, we should have documented how many mils of fluid we put into the bulb, and it was 10. And you also know that by looking here at the catheter here, and it says 16 French silicone 10 milliliters right there. So we know how big the bulb is. And then one thing I like to do is, once I take out my 10, I want to check it one more time, just to make sure that there's nothing in there.
Okay.
Okay, Miss Jones, on the count of 3, I want you to take a deep breath in.
Okay.
1, 2, 3. Okay, it's out. Was that okay?
Yeah, that wasn't bad at all.
Good, good. All right, and then what I would do is I would take my catheter into the bathroom and empty it and document that the Foley catheter was removed without problems, tolerated procedure well.
Okay.
And then we would want to make sure that she voids on her own within the next 6 to 8 hours, depending on the facility policy.
Okay. Very good.
Okay? And then I would lower my headrest or my bed down all the way and leave my call light in reach. And that's it.
Okay.